Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are delighted to be able to be with you this afternoon to talk about where we are with respect to COVID-19 across the entire state of Maine for today, Thursday, February 18th, 2021. I begin my update this afternoon on another sad note. The Maine CDC has received the report of another individual who passed away with COVID-19. He was a man in his 40s from Cumberland County, and his passing marks now the 655th death associated with COVID-19 in Maine since we began the pandemic. We'd like to take a moment to offer his family, friends, and entire community our deepest condolences during this time of grief. Right now in Maine, there are a total of 43,090 cases of COVID-19 across the state, representing an increase of 218 new cases since yesterday alone. Of those, 34,238 are confirmed cases, 8,852 are probable cases. Cumulatively, 1,495 people have been hospitalized with COVID-19, and in the past 30 days alone, 163 people have been hospitalized. Right now in Maine, 89 people are currently in the hospital with COVID-19. 27 of them are in the ICU, and 9 of them are on a ventilator. Turning next to some updates on where we are with our testing. Let's first start with the PCR positivity rate. On a 7-day basis, that number in Maine now stands at 1.36%. And it's corresponded by a testing volume that now stands at 590 PCR tests for every 100,000 people in the state. In terms of antigen testing volume, antigen testing positivity, the antigen positivity rate now stands at 3.4%, with a volume of 128 antigen tests for every 100,000 people. And finally, a few updates on where we are with respect to COVID-19 vaccinations. Let's start with the numbers. In total, there have been 265,991 total doses of COVID-19 vaccine that have been administered. 185,906 of those doses are first doses, and 80,085 are second or final doses of the COVID-19 vaccination series. We've also received confirmed numbers for the volume of vaccine that will be coming into Maine for next week. Overall, Maine will be receiving 27,740 new first doses that will be coming into the state next week. That comprises 13,700 doses of Moderna and 14,040 first doses of the Pfizer vaccine. That is a net increase of 3,510 new first doses of vaccine that are coming into the state next week. Let me just note a few things about that increase. The first is that simple arithmetic might suggest that the number of new doses is not 3,510, but rather 5,265. If you compare the total number that we're getting next week, 27,740, versus what we got this week. But in fact, the actual number is 3,510. Why is that? Well, that's because the federal government has officially changed its accounting system for how doses are calculated and put on the books. Everyone may recall that early on, in the first weeks of the vaccination process back in mid-December of last year, it was found that each vial of the Pfizer vaccine contained a 6th dose, Each vial was supposed to have 5 doses, but lo and behold, pharmacists were able to extract a 6th dose on a regular basis. Starting next week, the allocation numbers that are coming into states and that we will be reporting out will officially reflect the presence of that 6th dose. In effect, this makes explicit what was previously implicit. It will be the same number and type of vials, but there will just be a recognition of this 6th dose. But on top of that, and I think I misspoke a moment ago, because it's not the same number of vials. Maine is, in fact, getting an actual real increase in the number of Pfizer doses that are coming into the state. Up until now, and for the past several weeks, Maine has been pretty consistently receiving 9 so-called trays of Pfizer vaccine. Next week, we will be receiving not 9 trays, but 12 trays. So that's why, as a numerical matter, it looks like we're actually getting 5,265 new doses. The actual number of new first doses that are coming into the state is not that 5,265, but 3,510. That reflects both a recognition of the 6th dose as well as a real increase in the number of vials, new vials, coming into the state. This increase of 3,510 new doses is welcome, and we are thankful for it. Rest assured that we will work to get each and every one of those into someone's arm as quickly as possible. The next update that I'd like to provide is in connection with the movements of vaccine that we have been undertaking across the state. Since the first weeks of vaccination, we have sought to find instances where there might be a temporary mismatch between places that had more vaccine on hand and other places in the state that had vaccinators and patients ready to receive those. Where we see those mismatches, we always have moved vaccine from point A to point B to point C. We've spotted another one of those mismatches. In this instance, we have found that there are 3,900 doses of Pfizer vaccine at the CVS pharmacy warehouse. Those vaccines, as we've talked about in previous meetings, are not ones that were immediately scheduled to be administered. And thus, this Saturday, we are going to be moving those vaccines from the CVS warehouse to the state of Maine general pool so that they can be immediately used right now rather than being used at a later date that CVS was not able to specify for us. We are doing this because we want every single dose that is allocated to the state of Maine, again, to be placed and made available for Maine people as quickly as possible. So starting on this Saturday, we will be moving those 3,900 doses of Pfizer vaccine from the CVS warehouse into the general pool of vaccines here in Maine. And finally, one final update, and that's around the availability of open vaccination appointments. Here's the bottom line. There are appointments available right now and for the next several days at the Cross Insurance Center in Bangor. Earlier today, I spoke with the team from Northern Light that is operating the Cross Insurance Center site. And I spoke, among others, with Dr. Jim Jarvis, who noted that as they were reviewing their scheduled appointments, they found openings in their schedule. They have a significant number of openings in the coming days into next week. So if you are 70 and over and going to Bangor is available to you, please know that there are openings available and you can schedule your appointment for COVID-19 vaccination now. You do not need to be a patient of Northern Light Healthcare in order to receive a vaccine at the Cross Insurance Center. Again, if you are 70 and over and going to Bangor is available to you, please schedule your appointment now. You can do so in 2 ways. You can do so by phone by calling 207-204-0000 8551. That number again is 207-204-8551. Or you can sign up online by going to covid.northernlighthealth.org. Again, that's covid.northernlighthealth.org. Again, there are appointments available. If you are 70 and over and are able to travel to Bangor, please do not hesitate in scheduling an appointment now. So with that, I'm going to turn things over to our colleagues in the media. Commissioner Lambrew and I are happy to take any questions you have today. The first question for the afternoon goes to Chris Costa.
Hi, Dr. Shah, Commissioner Lambrew. Thanks so much for taking our questions. And pardon me, given the new information that was just announced about the CVS doses, I hope that this question can still be answered. But we were curious what's going to happen after the retail pharmacies, such as a CVS and a Walgreens, once they've finished with their vaccine clinics at long-term care facilities. What is Maine's plan to do with them? I know that the companies had announced they were planning to start doing vaccines in their retail stores for those people who are eligible, and I wasn't sure where Maine stands with that.
Yep. Chris, I didn't hear all of your question, but in general, I understood your question to be, where do we go with respect to our work with retail pharmacies? And you're right. Right now, many of the retail pharmacies, as well as independent pharmacies in Maine, are focused on vaccinating residents and staff of long-term care facilities. And we're working with them to round out that process as much as possible. But we also know that in many parts of Maine and for many Maine people, receiving a vaccine at a pharmacy is a standard part of how they get their vaccines, whether it's a flu shot or other types of vaccinations. So we're looking forward to working with CVS, Walgreens, Hannaford, Shaw's, just to name a few, to talk about and think about how we can make vaccine available in those locations. There aren't any final plans, and we also know that on top of our work with them, the federal government is separately but consistently with our work planning to support more retail pharmacies across the United States. So we're working both with the pharmacies as well as with the US CDC to time that so that when those assets are ready to go, we have everything lined up in Maine to make full advantage of it.
And I'll just add that while we are currently taking those unused doses from the retail pharmacy program to redeploy to other types of sites that are vaccinating people 70 and older, we are, again, working with Walmart with this extra supply that's coming from the federal government. We heard this week that the federal government will double that extra supply to pharmacies. Next week, we're working on where those particular vaccine doses may come. We still haven't gotten a specific number yet, but we do continue to try to finish this group of 70 and older through the channels that we've established. We're getting closer, but we're not quite there yet.
Thank you both. And just to kind of follow up, the 3,900 doses at the CVS warehouse that had not been used, there was a plan at some point to use them, but if I'm understanding you correctly, Dr. Shah, it's to move those doses so that they can be used right now. Is there some frustration by the CDC here in Maine that they hadn't been instantly allocated to be put in arms?
No, Chris, I don't want to suggest that we were frustrated or anything in that regard. We saw that those doses had arrived to their warehouse. In our communications with them, they didn't have an immediate plan to use them. So you are correct. It's not as if we are taking something away that was slated for use. They were in their warehouse. We spotted that. And so we are working with them to move those into the general population. This is just consistent with our overall approach to maximize the immediate use of every single dose that's allocated to Maine.
Understood. And then the last question I had for you, just because I want to let other people get questions in, was about COVID cases. Our state dashboard right now shows that people in their 20s seem to be getting COVID at a faster rate than some of the other age groups, especially since the new year started. Is there any indication as to why this is happening? And is there any concern from the CDC regarding the variant, how it affects young people, its ability to spread and the subsequent symptoms?
Yeah, sure thing, Chris. So, toward the end of last year, middle of last year, there started to be an epidemiological shift in who was getting COVID and thus who was the most at risk for it. It was initially something that afflicted elderly folks across the state, but we saw last year and into this year, more and more younger folks were getting it. And that trend has held true. I don't think it's changed significantly. It may have been exacerbated a bit, but right now we don't have any reason to believe it's necessarily because of the new variant. Indeed, we are concerned that the traditional ways that folks may be transmitting COVID, congregating, getting together with their friends, those things may be coming back into fashion, and thus there might be more cases arising among younger folks. We're keeping an eye on it. We don't have any hard and fast theories right now. We are keeping an eye on it. There's a reminder for everybody who's watching, particularly if you're a younger person, you're not immune to COVID. There have been just today an individual in their 40s who died of COVID, to say nothing of the higher number of cases. So it's important for everybody, older and younger Mainers alike, to do the things we've talked about, wear those face coverings, avoid crowds, making sure they are doing everything they can to stay safe.
Thank you both.
Let me turn things over to Jessica Piper next.
Thank you, Dr. Shah. I wanted to ask real quickly first about the CVS announcement that you made about the 3,900 doses. Is that related at all to the available appointments at Northern Light Health, or are those two separate?
They are separate things.
Okay, thanks.
Mm-hmm.
And with respect to vaccinations, the state, I think it was last week, made an announcement saying that you didn't want providers to offer pre-registration to groups that are not eligible yet. Was there a problem with providers that were doing that? Could you kind of elaborate on the decision making behind that?
Sure. It's a couple of things, Jessica. I think primary among them is we want to make sure that when we are opening up things like pre-registration, that they are coupled in somewhat relatively close time with an actual appointment. And if you've got folks that are pre-registering, but it could be months upon months before any vaccine is available for their group, it leads to various disconnects. People may pre-register in multiple locations, so on and so forth. So it was more to try to have a close relationship between the pre-registration process and then actually having an appointment being made available and being on the books. That was really the primary reason behind it. Commissioner Lambrew, I'll let you elaborate if there are others as well, though.
No, I think that is primarily it, because we do recognize that if you sign up and you wait for months, you may be distrustful of the system. You may be discouraged, and we don't want people to be discouraged. We want them to sign up closer to just in time so they get the information, and that's pretty near to when they can get an appointment. Again, we're hoping that we continue to move through this 70 plus age group quickly so we can begin to move on to other groups. Hopefully with the expanded supply that we just announced, that will go more quickly next week, but we are not yet beyond that age 70 and older group. We're going to continue to work our way through and hopefully get to all the other Mainers soon.
Thanks. And then, Dr. Shah, you went over some of the metrics at the beginning of your presentation. Obviously, we've continued to see cases decline. Is that related to, at this point, potentially some of the effects of the vaccinations that have happened so far, especially at long-term care facilities, or is that more just physical distancing and other?
It's a great question, Jessica. And as with any complicated multi-moving piece system, it's probably a number of different things that are happening at once. The epidemiologists that I've talked to have suggested that the vaccination rates that we have achieved as a country are not yet at the level where we would expect to see them causing decrements or decreases in cases. Generally speaking, and virtually every epidemiologist has a slightly different view of what that threshold needs to be, but the numbers that I've heard some of the experts toss around are in the 30 to 40+% range before you start to see an appreciable decline in the number of cases. But I think it is worth noting, Jessica, when you take a look at the numbers in Maine and you look at all the number of cases we had, and you also project about the cases that we know as well as the cases that we know are there but just haven't been diagnosed, and you couple that with the people in Maine who have received at least one shot if not 2 shots of vaccine, you do start to get into the 375 to 400,000 people range. People that either have natural immunity because they had COVID-19 or immunity generated by a vaccine. The question that I've asked a counterpart, a person at the CDC whom I trust and know to be extremely knowledgeable about these matters, the question that I've put to that person is, could the combination of people having recovered from COVID and having some degree of immunity plus the additional folks who are getting vaccinated, could those two things in tandem start to be part of the reason, part of the explanation for why case numbers have come down? I've asked them to look into that and analyze that situation. That is but one hypothesis, Jessica. Just want to stress that's a hypothesis. It's just as likely that there are other things, which is increasing mask wearing, increasing physical distancing, less congregation now that the holidays are behind us. There are all of these things happening in tandem with one another. You can't just point to one solution. It's so many things happening at once.
Do you think there's any relation to the fewer outbreaks in long-term care facilities?
I think there is more biological plausibility. That is to say, the vaccination rates, particularly in skilled nursing facilities, where we started our vaccination efforts. There is probably a straighter line that can be drawn between the vaccination rates there and the reduction in the number of outbreaks. They haven't made outbreaks go away, but they have come down, and that is a welcome sign. It speaks to the power and the promise of these vaccines.
Thank you.
Let me turn it to Robbie Feinberg next.
Thanks so much, Dr. Shah. I'll start with a question just that we're still hearing from different listeners about people over 40 who've been unable to get an appointment. I know you just talked about, for a vaccine, I should say. I know you just talked about kind of the increased appointments there in Bangor, but if someone still can't get an appointment, just, what are they supposed to do? What advice would you give them? And
Robbie, you use the age break of 40?
Oh, 70. I apologize
good.
On that one.
Just making sure. Okay, very good, because it does change the nature. What I would recommend is a few things. I would first start with the governor's own COVID-19 page. On that page, which you can Google or find by Googling Maine COVID vaccines. That's how I find it when I can't find my bookmarks in my browser. And there on that page, there is a list of sites, a number of sites that are offering vaccines to the public, places where you do not need to be a patient. Indeed, one of the conditions that we have attached to most every single recipient of vaccine in Maine is that those vaccines should be made available not just for your own patients, but for any willing member of the general public. I would start there. That's a good place to see what sites are available around you. The other thing is to recognize that depending on where you are, there might be other options. For example, Walmart may be an option that's also available. Going to their website may be a good place to start. And then the third, I know I've already mentioned it and you noted it, Robbie, but if going to Bangor is something that is an option for you, there are openings available at the Cross Insurance Center. That's a location that can accommodate, with their recent upgrades or their recent staffing increases, well north of 1,000 shots a day. And so if that's an option, that is a place to start.
And for those people who don't have access to internet, we are working on a call center, but you can call 211. That will also be able to help direct you to places where you can get help.
Great, thank you. One more question. With several vaccination sites obviously now up and running, how is the Maine CDC measuring the performance of each site right now in terms of how quickly they're getting out the vaccine? Or just what kind of metrics? I mean, obviously there's doses administered, but are there other things being looked at as well?
Yep. The principal one, Robbie, is how much of a particular allocation is used within a 7 or 7.5 day period. And that's the principal one that we look at. It's partly for performance reasons, as you suggested, but also for allocation reasons. If a particular location has, we measure that up against how many folks they have scheduled for the subsequent week. If a particular location has enough doses on hand and not that many people scheduled, then their allocation commensurately is lower, vice versa as well. But one of the metrics that we're looking at is just of a given allocation, how much of that they are able to use within a 7 or 7.5 day period. That half day is because on Monday morning, we want them to be able to vaccinate on that Monday morning without having to cancel appointments. That's one of the ones we're looking at, but we're also focused on equity as well, as we have been throughout the pandemic. So we're also looking within places to make sure that they are offering and conducting outreach to harder to reach populations so that everyone in Maine can access a vaccine.
Great, thanks. And I just want to get in one more question, was just about, so as we talked about the increased supply of the vaccine, as you both have mentioned about this, is that changing at all the timeline of when we might think vaccine eligibility could expand? I know numbers had been mentioned a few weeks ago. Do we have a sense of if that's been adjusted at all?
I don't know that it's been adjusted, Robbie, but it definitely helps. Commissioner Lambrew and I have stated on numerous occasions, as you referenced, the supply governs the speed with which we can vaccinate folks. And that speed, of course, determines how we move forward into other age categories. So it definitely helps the process. There is no doubt about that. I don't know that it's changed the analysis, though, at least not at this time.
Great, thank you.
Thanks, Robbie. Let me turn next to Evan Pop.
Hi, Dr. Shah, thank you. We've been hearing some concerns from advocates that the current focus on vaccinating older Mainers is leading to a racial disparity in who's eligible to receive a vaccine, just because people of color in Maine skew younger on average. Is this something the state is concerned about? And if so, is there anything state plans to do to address that issue?
Yep, I can start, and Commissioner Lambrew, please, as well. That is a concern, Evan, and it's a concern that we grappled with early on. I will say at the same time, as the governor has stated multiple times, her primary guiding principle is risk of death or severe disease. And so her policy actions, her decisions are guided by that notion of what can we do to minimize death from COVID-19, as well as minimize the number of people in the ICU, the number of people on a ventilator. And so there is that is the principle that we've applied. I think it's also worth noting, Evan, that even within individuals within 1A, phase 1A, for example, healthcare workers, many frontline healthcare workers, for example, those that work in long-term care facilities, those that work in those facilities in custodial or food service venues, are often Mainers of color or Mainers who are otherwise disadvantaged. By taking deliberate steps within 1A to cast a broad net forward patient-facing folks, we also managed to, we also cast that net in such a manner to ensure that Maine people who are disaffected, minorities and others, were able to access vaccine. It remains a risk. I don't want to minimize that, but we have taken that notion into account.
And in addition to the question of who gets the vaccine, we are working on this question of how. How do we work with community-based organizations, different coalitions, to make sure when an individual who is a person of color is eligible, we can connect them with the information, the sites, the transportation, and other supports needed to make sure that those individuals get vaccinated. We are working aggressively with these communities because we want them to help, develop those plans, them to empower their communities to figure out what is the best way when it is each individual's time to get vaccinated, that there are no systematic barriers for them doing so.
Thank you both.
Thanks, Evan. Let me go to Brian Sullivan next.
Thank you, Dr. Shah. I think Commissioner Lambrew mentioned 211 earlier, and just sort of going back, we receive a lot of questions daily about people in their specific situations. Where would you direct people if they wanted to actually speak with someone about what's going on and just get some information on getting the coronavirus vaccination and things like that?
I think Commissioner Lambrew is spot on. I think 211 is the right and the first place to start.
And then also, any other places, other than 211 where people could go?
That's really the best place, I think, for the vast majority of questions that folks would have.
You've talked a little about the Cross Center, and yesterday we were on a call and they said that they could do up to 5,000 vaccinations a day. Do you anticipate funneling more of the state's allocation through Bangor in the weeks ahead?
Well, Brian, I'll take a step back. It's not Bangor per se, and I should be clear. The reason that I'm mentioning them is because of a call that I was on earlier where they noted the availability of slots, not wanting to see a single slot go to waste. I offered to discuss that today with them, but with everybody here today, I made that offer. So I'm doing so with their consent, again, in an effort statewide to make sure that not a single slot goes unfilled. But more generally, Brian, we've throughout the vaccination effort looked to different types of vaccination venues, different channels to activate. One such channel is the very large scale, high throughput, public-facing vaccination sites, similar to what's in place right now at Scarborough Downs or at the Cross Insurance Center. Those are sites that can vaccinate, again, well north of 1,000 up to, as you said, 5,000 a day, vaccine permitting. We do intend to keep our a supply of vaccine going to those sites because we are in a situation of large scale vaccination. Only way we're going to be able to get 1.3 million people vaccinated, up to 2.6 million shots in arms, is in addition to other existing ways of vaccination utilizing these high throughput sites. But we're not using those to the exclusion of others. For example, commercial pharmacies, hospitals, even smaller scale sites like F2HCs are also able to offer vaccination. But Commissioner and I have made no bones about the fact that these large throughput sites, for folks who are able to access them, are a way to come in and get vaccinated in 15 or 20 minutes with very high efficiency and virtually no doses going to waste.
Yep, and we are going to continue to complement that activity with ideas like there are coalitions that have developed in Aroostook County and for some of the unbridged islands to begin to figure out how do they pool their resources to identify those pockets of older Mainers who are in rural areas. So we will continue to do both these large throughput sites to try to get through as many people in Maine as soon as possible, as well as these other strategies to try to get those who just will face barriers trying to get to those sites. So it is a not either or, but both and.
And just if I could get the biweekly statewide system update, how are we doing there?
Yep, progress is being made. We are again trying to make sure that the various moving pieces, that is to say, those who will use the site, who are operating such facilities, the vaccination sites, as well as the supply of vaccine. We're trying to make all of those pieces come together. Don't have a timeline for you yet, Brian, other than to say that we're still making progress on it.
Thank you.
Let me turn to Megan at WMTW next.
Thank you for taking my question. As you were talking about using every single dose of the vaccine, I wanted to kind of ask about the state's vaccine efficiency and full use policy. Can you kind of talk about it and what prompted it? I was more specifically wondering if that incident in Mexico with the clinic giving the extra doses to one of the RSUs, if that was what spurred it, and if that ambulance company was, if they were if they were in fact threatened, censured by a threat of losing their license.
Sure. So Megan, I'll start, and then again, Commissioner, please weigh in as well. Let me first start the situation in Mexico that you noted. Megan, so far as I'm aware, no such doses were administered, but we will check on that. I just want to be clear factually. But more generally, for a while now, we, Maine CDC and DHHS, have been receiving questions about what to do with a few of the doses that may be remaining in a vial at the end of the day. And we were receiving those from providers, practitioners across the state of Maine. And we were giving advice to folks based on the phone calls and emails we were receiving. But Commissioner Lambrew and I recognized a need to standardize that as well as make it very publicly accessible. And that was the impetus, the motivation for devising that policy and putting it on our website. It was not related to any one particular incident, but we wanted it to be generally applicable and public facing so everyone knew how we were thinking about using doses that were left over and would otherwise go to waste at the end of the day.
So if they would otherwise go to waste, it still is applicable that the people who get the vaccine are over 70. So they still have to go to somebody in the current phase that we're in.
Not necessarily.
Okay.
As the document, and it's available on our website, as the document notes, our overarching principle is that no dose should go to waste. And in recognition that for one of the vaccines, there is only 6 hours of time left after the vial is punctured in which all of the doses have to be used. And it may not be feasible to find somebody 70 or older within that 6-hour window to use up the one dose that is remaining in the vial at the end of the day, or 2 doses, however many it may be. And so the policy itself notes that in those situations, the first step is to try to find somebody 70 and older. Maybe somebody who's on a waiting list, who lives a couple of minutes away. Maybe a companion who is in the waiting room who didn't have an appointment for a few weeks, but now because of that extra dose, that appointment can just be moved up. That's the first place to start in the current phase in which we are in. If that's not feasible, however, the policy blesses vaccinating those who are, say, 65 and older, after you've attempted to focus in the current group. So we do make those allowances with the overarching principle that no dose go to waste. The other thing I'll just mention really quickly, Megan, and this is as much for folks who are out there vaccinating as much as anyone else. There has been a little bit of confusion about what a wasted dose is. A wasted dose is a dose in a vial that has already been punctured, where there are literally hours or minutes on the clock. That is what a wasted dose is. It has been in some cases interpreted as, well, Maine CDC sent us 100 doses, we've only used 30, so we've got 70 wasted doses on our shelf. That is not a wasted dose, that is an unused dose. We will find those and we will move them to a place that can use them. A wasted dose is one in which the clock is ticking.
Can you just quickly confirm whether or not you guys threatened to pull the license of the ambulance service?
Megan, I know we're talking with them. I think we're having discussions. I've only just gotten up to speed on that. We will find out, but I don't believe any, certainly not at Maine CDC. You use the word threat. That's not how we do business. We try to work with entities to make sure they have the right education and are operating in compliance with our rules and regulations, because we know that they are a vital part of our vaccination infrastructure. But I will check with our team to find out where we are in our discussions with them.
Okay, thank you.
Let me turn now to Eric Russell.
Thank you, Dr. Shah and Commissioner Lambrew. To follow up on Megan's question about the situation in Mexico, Rumford, how often is that sort of thing happening where these healthcare organizations have doses and they have some that might be at risk of spoiling? Is it, I mean, at the risk of criticizing them, and I don't want to do that necessarily, but can some of this be addressed by better planning, or is some of this just going to be inevitable?
Eric, so let me first start on the frequency. Again, I want to just draw that same distinction with Megan between a dose that could potentially go to waste, where literally hours are on the clock, versus the one that is a set of doses, vials that have not been punctured and thus really are unused. I want to, again, that's an important distinction, because unused vials, that happens all the time. As we talked about earlier in the briefing, we find we are always scouring inventory to move vials from point A to point B so that they can be used so there's no mismatches. That sort of load balancing, that happens every single day. Now, the business about potentially wasted doses and why we issued a full use guideline. I guess, Eric, let me flip the question around. If you're dealing with Moderna, for example, which has 5 doses in it, and you're running a clinic, and hypothetically you've got 6 people scheduled, are you going to tell that 6th person, sorry, we're not going to vaccinate you because doing so would involve opening up a vial, and we're not going to do that? The practice has been to say we're going to vaccinate people who are in our category, who are given a slot. If that means that there are a couple of doses that would otherwise be potentially going to waste, what we've seen consistently is that locations and sites are actually able to plan. They know that they've got 6 people scheduled. I'm hypothetically, these numbers could be much higher, but they know that they have X number of people scheduled. They know they're going to need Y number of vials, and thus that there will be a certain number of doses left over. And early in the day, they start calling folks. The other thing they're able to do is meter these things out throughout the end of the day. So they're only literally opening the bare number of vials that are needed. These situations are thankfully not commonplace. When they happen, that's why we put the policy out, but I don't want to suggest that they are the norm whatsoever.
Okay. The other question I had is a little bit broader, but there was a story out of Massachusetts today or yesterday that involved what they call the buddy system. And this is where, caregivers of elderly individuals or older folks who give rides to clinics are also offered vaccinations. I wonder if you guys have given any thought to that, and also, kind of on the similar vein about home healthcare workers who are helping, homebound Mainers, people with, bathing or other personal needs, and they've yet to be vaccinated too, even though they're kind of healthcare workers. So I wonder if you could update us on whether you've given any consideration about this buddy system, and then home healthcare workers who maybe, don't fit the definition of frontline workers or just going in to help with some personal care needs.
Commissioner, well, let me start, Eric, really quickly on the home healthcare workers. They are part of phase 1A. Indeed, okay. In the very first week's allocation back in December 14th, home care agencies in Maine received allocation of vaccine. So they are and have been part of 1A. As to the buddy system, as you called it, Commissioner, I'll turn that over to you.
Well, and I will just make a slight clarification. Home health workers are in 1A. There are some type of direct services people that are not necessarily providing healthcare. So
yeah, I think that's what I was referencing, Commissioner Lambrew, is those that weren't necessarily providing healthcare in the traditional sense, but more life skills and that sort of thing.
Yeah, and look, I will just say, as we have said about teachers and so many other people who are providing critical services, we will continue to work our way through our 70 and older age group. We will then look at our 65 to 69-year-old group and see how quickly we can get through them given supply, and then turn to those groups, recognizing that there are just so many workers in the state of Maine that fall into this category of being up close and personal, taking care of people, being at risk on those front lines. Yet with our our vaccine supply remaining constrained, it is not yet an option for us to go to those groups. We will get there. The governor is committed to getting to every person in the state of Maine as quickly as possible. We're just not there yet. Okay. Turning to the Massachusetts model, everybody's looking and seeing how it's going. There have been some concerns raised about whether or not it's appropriate for somebody to go on eBay to find a person age 75 and older to be a buddy with, whether there could be some sort of potential financial inducements that go on, which would be inappropriate. So I think there are some concerns that have been raised, but we're watching because the state of Massachusetts has been trying to find innovative ways to make sure that every person over the age of 75 gets vaccinated. So we are hopeful that they are successful, but we are in a wait and see mode right now. And
real quick, Dr. Shah, were there any more variants detected today?
There were not. Okay. We are continuing to go through that process of sequencing samples that we receive, a subset of them. We have not detected any new ones today, or none that I'm reporting on. We haven't detected any, but we are receiving reports from the sequencing clinical laboratories on an ongoing basis. If and when we find new cases of variants, which is almost a certainty that we will update everyone.
Thank you both.
Thanks, Eric. Let me turn to Amy Brown next.
Thank you. And that kind of leads into what I was going to ask about with the variants. When someone tests positive for one of the variants, I know it's only happened twice so far, but if any of their close contacts develop or test positive for COVID, would they also have samples sent to the lab to be tested for variants? And how long does that process take once the sample's at the lab?
Well, so the process of testing and undertaking that whole genomic sequencing which really is something that we do in partnership with the Jackson Laboratories and the US CDC. It takes anywhere from 5 to 7 days. It is a very technical process. It involves breaking down the virus and literally going RNA molecule by RNA molecule and developing a list of every single RNA molecule within the virus and understanding how that matches up with an international database of others. It takes a long time from a laboratory perspective. It also takes a long time from a computational perspective. There are improvements on the way to speed it up, but right now it takes anywhere from 5 to 7 days. The advice from the US CDC has been, generally speaking, if someone has a variant, to treat that variant individual, that case of the variant, as we would any other case. That is to say, recommend that individuals receive any household contacts be tested, given their close contact with the individual who's tested positive, be tested immediately, and then also again a couple days later. The CDC has not recommended that we routinely send those samples for genomic sequencing because the approach from a public health perspective is the same in that situation.
Okay, great. And we were contacted by a person who is a semi-retired nurse that's been talking with other nurses that are retired or semi-retired but still licensed, who would like to assist with vaccination efforts, and they've registered through the Maine Responds website, but they haven't been contacted, and they're wondering if that's because of their age or if it's more related to there's just not a demand for that right now.
Let me be very clear, Amy. It has nothing to do with their age whatsoever. And indeed, throughout the course of the pandemic, when we have tapped into volunteers, we've looked for skills and willingness to serve. Age is not a factor that we take into account. So let me just be very clear on that. With respect to the availability to serve as a vaccinator, much of the vaccination in Maine that's occurring right now is being done under the auspices of hospitals and health systems or by EMT groups or emergency medical providers, to say nothing of public health nurses, independent pharmacists. They've been the ones out there that have done much of the vaccinating to date. But as we receive more vaccine, we will invariably be ramping up our vaccination efforts. So the fact that we haven't yet activated any of the volunteers is not an indication that we won't do so in the future. We ask everyone who would like to serve as part of the vaccination effort to register at Maine Responds, to register when you can participate, where, how many days a week, for what duration of time. We thank people for that effort to stand up and say, I want to help. When we get to the point where we will need those folks, rest assured we will absolutely be looking into them.
Great. And just a quick question, I believe, for Commissioner Lambrew, or maybe you know the answer to this, Dr. Shah. How many people are in the 65 to 70 category?
There are 92,000 people in Maine in that age category.
Great. Thank you.
Mm-hmm. Let me turn to Dustin at New England Cable News next.
Hi, Dr. Shah. First, what's the latest on the potentially counterfeit N95 masks that were sent to Maine, and how have these masks been identified and how are they being retrieved?
I'll begin by saying we have contacted the appropriate enforcement authorities about this to ensure that we are tracking down where they came from and what went wrong. We also have already immediately identified everyone that was distributed. Not that many were distributed to different partners, to make sure that they are not in use. We have offered and replaced those N95s when asked to make sure that there's nobody going without it. And we are looking to see how we, going forward, number one, can learn from what happened. How do we prevent this from ever happening again? But number two, make sure that here in the state of Maine, we have sufficient N95 should we have another surge of COVID-19. So we take this very seriously. We are, again, pursuing the appropriate channels to make sure that if there was wrongdoing, which we suspect that there was, that will be prosecuted to the extent possible, as well as securing additional PPE for our healthcare providers, long-term care facilities, and other people on the front line to make sure that they stay safe.
Where did some of these affected masks go specifically? Are there specific school districts that you found them in or other places like that?
I am not familiar with the specific school districts. There were about 60 of them, is my understanding. We did, through the Maine CDC, very specifically track what types of EMS or other organizations got them, and again, notified them quickly. We also, within the Department of Health and Human Services, have our own psychiatric hospitals and some of our own clinicians who were on the receiving end. Again, we quickly withdrew those and replaced them. So it was a scattering of different types of organizations. And to our knowledge, it has all been, again, put to the side with replacements coming in to make sure that those workers stay safe.
And then is there a determination being done as to how effective these masks were, are, what the scope of the impact of them being out there was, and where is that work being done?
So we did get a national recall notice about these potentially counterfeit N95s. As reminders, going through an analysis to figure out what potentially, whether they're effective, but we do know that they haven't gone necessarily through that NIOSH kind of certification process, which is why we took the action immediately upon receipt of that recall notice to, again, set them aside, let the investigation continue, and replace them.
So until the federal government says something, they're just sitting somewhere while the federal government's investigating what's going on?
Yes, and I will, and Dr. Shah, you may know if it's the federal government. Is it, I think it might be NIOSH is doing this.
I believe it's NIOSH, yep, which is the National Institute for Occupational Safety and Health, a subunit of the US CDC. And there may be other law enforcement entities involved in the investigation. I don't know that Commissioner Lambrew and I are familiar with that piece, but from an efficacy perspective, that's where that analysis is happening.
And then
in our own office of the Attorney General will also, on our side, on our behalf, try to reclaim any payments that were made on behalf of the state for these potentially counterfeit masks.
So there is a legal document being drafted. Sorry to keep going on. It's just, this is an extended conversation about this issue. So is the AG's office working on a lawsuit or joining a larger lawsuit with other states?
I think I would direct you to the Office of the Attorney General about exactly what they're doing. We were in contact with them upon receipt of this recall notice. They are acting on behalf of the state of Maine, primarily directly with the particular vendors involved in this. But in terms of whether they're joining any sort of larger action, I would defer you to their office.
Dustin, one really important note in concert with the questions you've raised, which is around our process for vetting PPE. Early on in the pandemic, when we realized that we were going to have to go it alone to some extent and make sure that we were securing our own state-based supplies of PPE, we put into place a process. In fact, we tapped a staffer from the Maine CDC to oversee all of this. And one of the essential non-negotiable elements of that process is that any potential vendor needed to send us a large number of samples of any of the products that they were offering to us. And we put those samples through their paces. For example, in the setting of an N95 mask, we would take a number of their samples and actually do a fit testing on them. We would put them on somebody and go through the process of putting a hood on them, spraying the bitter liquid to see if the person could sense it or taste it. And if they could, then it failed. And that was it. There were no other discussions with that vendor. We did that in the situation of this vendor. And all of the samples that they sent to us passed our vetting process. The bottom line there is that what we ultimately received was not what was sent to us as samples. So that's a really important point. We didn't just open up the catalog and say, those look good. We demanded samples, we put them through their paces, they passed our paces, but what we got was not what they sent us initially.
Got it. And lastly, how long were some of these masks out there? Is there an indication of that timeline?
I'd have to go back and check. I think it was a few weeks. Some of them were received in early November. But yeah.
Yes, November.
Thanks.
Yep. Let me turn next to round out the evening to Patrick Whittle.
Thank you very much. We learned last week that the religious gathering restrictions have been changed somewhat to be made more accommodating, but the Roman Catholic Diocese has said that this won't functionally increase capacity or accommodation limits at too many Catholic churches in the state. Is the state aware of that bit of criticism from the diocese, and is there any response to it?
I'll begin by saying throughout the pandemic, the governor has striven to balance out the needs of protecting public health with other important considerations like those of houses of worship. The executive order that was issued last week that extended the capacity limits in houses of worship from a cap of 50 to a percentage of capacity did expand capacity in houses of worship. That was done to apply the standard in a fair and equitable way. The same one that we use for a large retail space would apply to houses of worship. We continually review our public health measures in light of concerns. The governor's office has spoken multiple times with representatives of the Archdiocese, along with other faith communities. We anticipated that this would be responsive to some of the concerns about equity, and we will continue to review our public health guidance in the coming weeks and months, as we always have done. We recognize that we are in a period of change. We are monitoring those changes, looking at our guidance to see what else might change going forward. But the action taken last week was in response to concerns about equity, which that executive order addressed.
When you say equity, do you mean between houses of worship and retail spaces? How they were brought to sort of an even keel?
Correct.
Okay, great. Understood. Thank you very much. Being situated here at the back of the line, my other questions were handled already, so thank you to everyone for that.
You bet, Patrick. And thank you all for tuning in this afternoon, hearing the latest of where we stand across the state. I appreciate everyone's time this afternoon. We look forward to catching up with everyone next week on Tuesday to talk more about where we stand and where we're going. In the meantime, as always, please be kind, take care of one another. We'll catch up again next week.